So I think the question should be, who should we treat rather than should we test? I think we as urologists have to get better at making that decision for you and helping you make that decision and not over-treating. And that's why I support the testing for prostate cancer. So PSA, what is it? It's basically a chemical made by the prostate. It's normal, it doesn't hurt you. It's not like having high cholesterol. Men often say it's high, how can I get it down? You know, is it hurting me? It's not. It's just an indication of activity. The commonest thing that puts it up, how am I doing, Cameron? I think I'm going pretty slowly today. The commonest thing that puts it up is non-cancerous enlargement of the prostate. So that central stuff that we get, that makes PSA, normal prostate makes PSA, prostate cancer makes PSA, bike riding, Rob's a keen bike rider, puts your PSA up, ejaculation. Lots of things can put it up, and it can go up and down. Now this is, again, another little conceptual thing about PSA. We're constantly trying to find ways to use PSA more effectively, because it's not a perfect test. And we're starting to look at now what's called the median PSA. Now, those of you who remember your high school maths, the median is something like the average. What's the average PSA for a 40 to 49-year-old? It's 0.7, 50 to 59, 0.9, etc. You know, when you get a blood test done, they usually tell you what the normal range is. There are the normal ranges. But we've started looking at these medians. And these medians are pretty low, really, compared to the ranges. And it's been quite useful. And this is why I think you should be tested from the age of 40, is if your median PSA is a little bit high, let's say it's 2.5, let's say it's 2.6 when you're 45, your lifetime risk of getting prostate cancer is 100 times the average person's. And that doesn't mean you've got it, that means your lifetime risk. So if you've got a high median PSA when you're young, you're a person at risk, and you're the person we want to watch carefully. When you get to 50, let's look at the 2.6 person again. You know, you're 55. If your PSA is 2.6, you've got a 27 times chance. Not 100 anymore, it's dropped to 27. When you go to 60, let's go 2.6 again. 8 times. So, gee, that median PSA doesn't seem to be as predictive of high risk of cancer the older you get. And anyone know the reason? The biggest thing that makes PSA is that non-cancerous growth, the normal non-cancerous growth that slows down your waterworks as you age. When do you get that? As you get older. So your biggest thing that clouds your picture of your PSA and makes it less useful occurs when you're older. Doesn't it make sense to get tested when you're younger when actually the PSA test is more valuable? And it doesn't mean you've got prostate cancer, it just means you're a person we want to watch. So what to do? I think you should start testing your PSA at the age of 40. We'll talk to your doctor about it. There are controversies, and I know the College of General Practitioners doesn't recommend prostate cancer testing because of the controversies that exist and the over-treatment that's occurred. So I think you should, but however, I do think you should start testing at the age of 40, and then depending on what the results are, you go on from there. If you're an at-risk person, you should be checked from the age of 35. So that's what you should do, I believe. Here are some other examples of what you shouldn't do. And again, what is it with ladders? My father nearly killed himself on a ladder at the age of 75 recently. So who's at risk? The more first-degree relatives you have, that is fathers, brothers, with prostate cancer, the more at risk you are. So I see this not infrequently. Prem and I see this quite frequently where we get men, yep, my 2 brothers and my father had prostate cancer. Guess what? You've got a really high chance of getting prostate cancer. You should be checked out at an early age, particularly if your father or your brother got prostate cancer at an early age. It's more likely to be the familial type. Most aren't. Only 10% are the familial type. But if that is you, get checked early. Now, look at your iPads, kids. It's not as bad as all that. Providing you pick someone with hands like mine or Prem's. But most of you come along and think it's going to be something like this. Well, only if we don't like you. And all I can say is thank God that this guy isn't a urologist. Sorry, I know I use that joke a lot, Peter, but you're a great prop to have in the audience. So rectal exam, why do I have it? I've had the blood test. The blood test is fine. Why do I need the rectal examination? Because some prostate cancers don't make PSA. And some of those can be really aggressive ones. Prostate cancers are really just abnormal proliferation of whatever the organ is. So it's normal that prostate cancer makes PSA because that's what the prostate does. But if the prostate is so bizarre, the prostate cancer is such a bizarre cancer, it can't even make PSA. All it can be is a really nasty cancer. So sometimes we do see men with low PSAs, low normal PSAs with prostate cancer, and they've been picked up because their GP has done a rectal examination. And so it takes about 10 seconds. It's not that bad. I know, I've had it done too. All right, so even if your PSA is normal, if you've got an abnormal rectal examination, we do talk to you about having a biopsy. So in conclusion, urinary symptoms are common as men age. Early prostate cancer rarely has symptoms. That's an important point. There are no real pointers. If you've got urinary problems, it's due to the non-cancerous enlargement. PSA and rectal examination can save lives, and it's certainly the young guys, those dark grey group with the more aggressive cancers, they're the ones we want to find. And always one day I hope, like the poker night was fantastic, we had a room of 40-year-old men, the ones that have got the most to lose by not being tested. But we have to become smarter in deciding who needs the treatment rather than should we test. Thank you.